हेलो फ्रेंड्स, लास्ट वीडियो में हमने एंथ्रोपोमेट्री तक देखा था। अभी नेक्स्ट देखते हैं। नाउ द प्यूबर्टल चेंजेस इन गर्ल्स एंड बॉयज़। प्यूबर्टल चेंजेस इन गर्ल्स एंड बॉयज़। प्यूबर्टल चेंजेस जो होते हैं अर्ली सीन इन गर्ल्स, जल्दी दिखाई देते हैं गर्ल्स। उसमें 5 स्टेजेस बनाए गए हैं, 1 2 3 4 एंड 5। इनमें डेवलपमेंट ऐसी होगी इन द स्टेजेस ऑफ, उनको बोला जाता है टीलार्क। सीक्वेंस ऑफ प्यूबर्टल चेंजेस में पहला है टीलार्क, देन प्यूबार्क, देन ग्रोथ स्पर्ट एंड मेनार्क in girls. Telarch is enlargement of breast buds. Pubarch is pubic hairs and axillary hairs. Growth spurt, sudden increase in the height. And menarche, starting of menstruation. So ये changes or sequence of pubertal changes in girls. In boys, first one is testicular enlargement, then penile enlargement, then pubertal changes or pubarch, then growth spurt is seen, and axillary hair and facial hair, axillary and facial hair growth. ना ये important question है कि growth spurt in girls is stage 3 and growth spurt in boys is stage 4. So girls में stage 3 and boys में stage 4 growth spurt. ये सब स्टेजिंग दी है टैनर ने एक स्टेजिंग दी है सेक्सुअल मैच्योरिटी रेटिंग स्केल। उसमें स्टेजेस है स्टेज 1 to stage 5. स्टेज 1 इज प्री प्यूबर्टल and stage 5 is adult like. These are stages. No need to remember everything. Stage 5 is adult one, like adult changes. इसमें ये याद रखो, secondary mound is in stage 4. Secondary mound is some breast changes are there. Just remember secondary mound is stage 4. Then breast areola enlarge and darker hair growth is seen in stage 3. बस इतना important है इसमें. Sexual maturity rating scale given by Tanner. Then next one is developmental milestones. इसमें है ग्रॉस मोटर, फाइन मोटर, सम सोशल. इसमें ग्रॉस मोटर में आएगा बेबी का जो डेवलपमेंट होता है सबका सेफेलोकॉडल होगा, हेड टू टो तक सेफेलोकॉडल. तो पहले डेवलपमेंट यहाँ पे होगी, देन नीचे डेवलपमेंट होते जाएगा. सो पहले आएगा नेक होल्डिंग comes at age of 3 months. Neck holding come at 3 months. Then roll over from chest to back 5 months. Then sitting will start in 6 months. But it is with support. Sitting with support is 6 months. Then sitting without support at 8 months. Then after sitting, babies start to stand with support in 9 months. Stand without support is a 12 month. Then again child will start walking now at 15 months, and then child will run at 18 months. Remember this, like in marathon they will run at the age of 18 months. Then okay, now at the age of 2 years, child will go upside on the stairs with 2 feet and go down with 2 feet at the age of 2 years. Walk up and down stair or jumps. Walk up and down stair at the age of 2 years. Then at the age of 3 years, alternate step he will go upside. At the age of 4 years, he will go downside, alternate feet. So at the age of 3 years, alternate feet going upwards, and at the 4 years, alternate feet going downstairs. Okay. Then ride tricycle. Tricycle at the age of 3 years. This is important. And will start hopping or jumping at the age of 4 years. At the age of 4 years. Okay. Then next one is fine motor. Fine motor will, with the help of muscle group, हैंड मसल जो होते हैं, हैंड मसल ग्रुप डेवलपमेंट की वजह से होगी, राइट. सो पहले बेबी का अप्रोच जो होगा विच इज़ बाइडेक्स्ट्रस, दोनों हाथ से रीच करेगा एक ऑब्जेक्ट के पास at the age of 4 months. Then unidextrous at 6 months. Then immature pincer grasp and mature pincer grasp at the age of 9 months and 12 months. Then baby will start scribbling like this. Scribbling will start at 15 months. Then same at the age of 15 months, 2 tower block. 18 months, 3 tower block. At the age of 2 years, 6 tower block. This is important. At the age of 2 years, 6 tower blocks he will make. And 3 years, 9 tower blocks. Okay. Now baby will make circle. At the age of 3 years. Then copies a cross or a square at the age of 4 years and triangle at 5. We'll revise this again. Okay, everything. Then language milestones. At 1 month he will alert to the sound. 3 months he will start cooing, making sounds. At the age of 4 years he will start laugh aloud. Then 6 month monosyllable like ba, da, pa. Then 9 month में bisyllable like mama, baba, dada. Then 12 month पे 1 to 2 words. 12 month में 1 to 2 words. At the age of 18 month, 8 to 10 words. At the age of 2 years, 2 word sentence or 3 word sentence using pronouns. This is important. Using pronouns is at 2 years. Then at 3 years, ask question like who are you, what is your name, and knows full name and gender. At the age of 3 years. This is also a question. Remember important points only. According to me, no need to remember everything. Just important वाली चीज़ें याद रखो. Then songs and poem at 4 years. Tell story at 4 years. Ask meaning of words at 5 years. Right? Then social milestone. In social milestone, social smile at 2 years. Recognizes mother at 3 months. Stranger anxiety at 6 months. Then wave bye bye. Write 9 like this. 9. So 9 and bye. Baby do bye bye at 9 years. Then comes with a when called and simple ball game. Simple ball game is important. At 12 month. 12 महीने पे ball game खेलेगा. Then 15 month पे jargon speech. Jargon speech is कुछ बड़बड़ाएगा बेबी बट समझ में नहीं आएगा वर्ड्स. Jargon speech. 18 month पे copies parent in the task. Then 2 years ask for food, drink and toilet. Then 3 years shares toys and full name and gender and ask question. 4 year plays cooperatively in the groups and go toilet alone. This is important. Go toilet alone at 4 years. Okay. बस याद करना है दोस्तों इसको. Then एक बार रिवाइज कर लेते हैं. At 6 month sit without support, sitting. with support. 6 month में sit with support and without support पहले लेगा, then stand with support and without support, then at 15 month he start walking and 18 month start running marathon. Then one important one, at the age of 8 month, 10 month and 11 month baby start cruising, crawling, creeping and cruising. What are these? So we will start crawling at 8, creeping and cruising. Then at 4 month bidextrous, 6 month unidextrous, immature and mature pincer grasp and start scribbling. Then at 15 month 2 tower block, 18 month 3 tower block, 2 years 6 tower block and 3 years 9 tower block. Then for remembering this is important question, so we will make it like this. Okay, बच्चा बन गया है. Then 3 years, 4 years and 5 years. You can remember like this: circle at 3 years, square at 4 years and triangle at 5 years. And baby can draw a line, straight line at the age of 2 years. 2 ends are here, so 2 years. Now language milestones now, at the age of 6 month monosyllable and at the age of 9 month bisyllable. Okay, baby can undress with the help at 2 years, dress with the help 3 years and undress and dress with no help at 5 years. Himself he can do. Okay, ज़्यादा स्ट्रेस नहीं देना, इम्पोर्टेंट वाले याद रखना. Then developmental quotient will say developmentally baby is delay or growth is, or the development is going good. So developmental quotient is developmental age and chronological age into 100. Developmental age upon chronological age. then developmental delay कब बोलेंगे? Developmental delay when this ratio will come or percentage will be less than 70%, then it is developmental delay. Then GDD, global developmental delay, when baby is developmentally delayed in more than or equal to 2 setting or more than or equal to 2 frames, then it is global developmental delay and it is seen in cerebral palsy, CP, cerebral palsy. Okay, the next point is nutrition. The main nutrition for the baby is breastfeeding. Up till the age of 6 months, exclusive breastfeeding should be there. At the age of 6 months, and we can ask mother to continue it up till 2 years, because brain growth is happening. Brain growth happens at the age of 2 years. 90% of the brain growth at 2 years. Then some other features of breastfeeds: immunological, nutritional features are there. In immunological, IgA antibody is formed. Then because of low PABA is para amino benzoic acid. This is low in breastfeed. तो ये कैसे हेल्प करता है बेबी को? इन प्रिवेंटिंग मलेरिया. अब इसकी लो लेवल है तो मलेरिया से कैसे प्रिवेंट करेगा? बिकॉज मलेरिया का जो प्लाज्मोडियम होता है, एनाफिलस वगैरह, उनकी जो ग्रोथ होती है वो पाबा की वजह से होती है. एंड ब्रेस्ट फीड में पाबा इज लो, दैट्स व्हाई इट प्रिवेंट्स द मलेरिया. देन लैक्टोफेरिन and bifidase factor prevent from E. coli infection, and bile salt lipase prevent from Giardia infection. Okay. Then calorie. How much calorie is in breastfeed? This is important question. How much calorie is in breastfeed? That is 67 kilocalorie. 67 kilocalorie in 100 ml. 67 kilocalorie in 100 ml. Then majority of carbohydrates is lactose. Majority of carbohydrates is lactose or other galacto-oligosaccharide. Galacto-oligosaccharide is not important. Lactose is major carbohydrate. Then protein. Breast milk is rich in whey protein. And important amino acids in breast milk are taurine and cysteine. Important for brain growth. And in breast milk there is polyunsaturated fatty acid. That are docosahexaenoic acid and arachidonic acid. They also promote brain growth. So 3 important चीजें for brain growth के लिए अमीनो एसिड कौन से? टॉरिन, सिस्टीन and fat is docosahexaenoic acid for brain growth. Then deficiencies. What are the deficiencies in breast milk? Vitamin K, vitamin D, B12 अगर mother is strictly vegetarian है, and iron deficiency. So KD B12 iron. So vitamin K injection is given at birth to the newborn baby. Then vitamin D supplementation also given. अगर मदर स्ट्रिक्टली वेजिटेरियन है तो B12 डिफिशियंसी होगी. B12 डिफिशियंसी से मेगालोब्लास्टिक एनीमिया. देन आयरन डिफिशियंसी, बट आयरन विल स्टार्ट हम लोग मोर देन 6 मंथ पे. जब कॉम्प्लीमेंट्री फीड चालू करेंगे तब आयरन सप्लीमेंटेशन चालू करने बेबी को. देन व्हाट आर द कॉन्ट्राइंडिकेशन? कॉन्ट्राइंडिकेशन कैन बी एब्सोल्यूट और रिलेटिव. इन रिलेटिव कॉन्ट्राइंडिकेशन, अगर HIV इन्फेक्शन है मदर को, HIV and TB and herpes. These are relative contraindication. Then what is absolute contraindication? Absolute is अगर मदर कीमोथेरेपी पे, मदर ऑन कीमो और रेडियोथेरेपी, या फिर बेबी में गैलेक्टोसीमिया है, गैलेक्टोसीमिया एंड lactose intolerance. These are contraindication. The storage of breast milk can store at room temperature or refrigerator or freezer. One question will sure come, a very important question. So at room temperature we can store it at for 6 to 8 hours. In refrigerator up to 24 hours, and in freezer up to 3 months. In -2 degrees Celsius we can keep breast milk up to 3 months. This is a storage of breast milk. At room temperature 6 to 8 hours, refrigerator 24 hours, and freezer 3 months. Then next one is malnutrition. In malnutrition, acute malnutrition, chronic malnutrition, and uska management. When need to manage the baby? In acute malnutrition, there are 2 terms: wasting and stunting. नाम में है. वेस्टिंग अगर है तो वेट कम हो गया है, स्टंटिंग अगर है तो हाइट कम हो गया है. तो इनके लिए रेशियो कौन सा होगा? वेट फॉर हाइट, एंड स्टंटिंग में हाइट फॉर एज. This is very important. Weight for height and height for age. क्वेश्चन में ये कंफ्यूज कर देता है, वेट फॉर हाइट एंड हाइट फॉर एज. हाइट फॉर एज. अगर वेट फॉर हाइट कम है बेबी का देन इट इज़ वेस्टिंग, एंड हाइट फॉर एज कम है तो स्टंटिंग. एंड दिस इज इंडिकेटर ऑफ एक्यूट माल न्यूट्रिशन. वेस्टिंग इज इंडिकेटर ऑफ एक्यूट माल न्यूट्रिशन एंड स्टंटिंग इज इंडिकेटर ऑफ क्रॉनिक माल न्यूट्रिशन. सो एक्यूट के लिए वेस्टिंग एंड क्रॉनिक के लिए स्टंटिंग. देन मैनेजमेंट कब होगा? अगर बेबी इज टेकिंग गुड ओरली और appetite is good and no complications are there, then home based management can be given. Home based management or family health care worker can supervise the baby at home only. But when to hospitalize or when to treat the baby if appetite is not good appetite, or some complications are present, then treatment is required or admission is required. Then there are two terms, marasmus and kwashiorkor. This short question, kwashiorkor and marasmus. So दोनों इमेजेस देख लो. इमेज आती है तो इमेज से ही डायग्नोज हो जाता है. marasmus is a adaptive malnutrition and kwashiorkor is disadaptive. What is adaptive and disadaptive? In adaptive, बेबी ने अडेप्ट कर लिया है जो माल न्यूट्रिशन है, बेबी हैज़ अडेप्टेड इट एंड बेबी का जो बॉडी है वो शो करेगा कि माल नरिश है बेबी. सो इसका ट्रीटमेंट जो है वो जल्दी स्टार्ट होगा, ट्रीटमेंट अर्ली स्टार्ट होगा एंड इसका गुड प्रोग्नोसिस होगा. बट in kwashiorkor the baby is edematous, looking healthy, so treatment will start late and poor prognosis in kwashiorkor. Marasmus is monkey face, or old man appearance, vision appearance, thin limbs are there, muscles are lost and underweight baby is marasmus baby. And in kwashiorkor, very important questions are there. There is swelling of legs or edema or generalized edema is there, that is generalized edema, anasarca. Then flaky appearance of the skin. There is fatty liver, flaky appearance of the skin, or flag sign is seen in hairs, normal hair in marasmus, and moon face or edematous face seen in kwashiorkor. Right? Then what is SAM? Severe acute malnutrition. लास्ट वीडियो में हमने 2 क्राइटेरियाज बताए थे, that is presence of bilateral edema. Second one is mid arm circumference is less than 11.5 centimeter, which was measured by Shaker step. Then third one is severe acute malnutrition. So we will take wasting or stunting. We will take wasting. So wasting is weight for height. Weight for height is less than -3 standard deviation. Now less than -3 standard deviation हमने कहाँ का देखा, अभी सैम ने देखा. And one more is microcephaly. Others are below 2 standard deviation. Now next one is what are the complications in malnutrition. This can be remembered as shielded mnemonic. So S say sugar deficiency, that is hypoglycemia. H say hypothermia. I infection and septic shock. Electrolyte imbalance, that is hypokalemia. D say deficiency of iron, vitamin and other micronutrients. D say dehydration. So need to treat this complication accordingly. For sugar, for hypoglycemia, हम लोग hypoglycemia कब बोलेंगे? Hypoglycemia when sugar level is less than 54 milligram per deciliter, and it is treated by 5 ml per kg, 5 ml per kg of 10% dextrose, and followed by oral or IV fluids. Then hypothermia can be treated by gradual, it's very important, gradual rewarming should be there, and rapid rewarming अगर करेंगे, it may lead to disequilibrium in the brain. Then eyes infection and septic shock. Most common infection is E. coli. Other can be staph infections can be seen. Most common is E. coli. So treatment is given by antibiotics like penicillin and aminoglycosides. In electrolyte imbalance, hypokalemia and hypomagnesemia can be seen. Hypokalemia and hypomagnesemia is present. Then very much important question is here, what is the serum sodium level? Serum sodium level is low, but the body sodium is high. जो इंट्रावास्कुलर स्पेस से सोडियम चला जाएगा बाहर, अलॉन्ग विद दैट वाटर भी चला जाएगा. सो देयर विल बी इडिमेटस. इन क्वाशियोरकर हमने देखा, इडिमेटस बेबी विल बी देयर. सो इन सीरम सोडियम इज लेस बट द बॉडी सोडियम इज हाई. So the additional sodium should not be given. Additional sodium is not given. The deficiency of vitamins, iron and micronutrients can be supplemented. And dehydration कैसे treat करेंगे? ORS? No. ORS is given in normal dehydration or diarrhea, but in malnutrition we give Resomol, rehydrated solution for malnutrition, Resomol. So normal ORS में और इसमें क्या डिफरेंस है? ORS में सोडियम 75 होता है, ग्लूकोज 75, क्लोराइड 65 and potassium. How much is potassium? Potassium is 20. So in malnutrition we know, सोडियम लेवल बॉडी में ज़्यादा है, एडिमा है, सीरम में कम है, अपरेंटली लो है, बट हमें सोडियम नहीं देना है, बॉडी को सोडियम नहीं देना है. सो मतलब कम करना है. सोडियम इज 65, कम कर देंगे सोडियम, बट पोटेशियम लेवल विल बी मोर, 40. एंड ग्लूकोज भी बढ़ा देंगे. दिस इज रेसोमॉल सोल्यूशन फॉर माल न्यूट्रिशन. Okay, thank you guys. This is my Insta ID. You can send any queries to me. You can please like to the channel if you like the videos, and please subscribe to the channel for more updated videos, and please share with your friends. Thank you guys. I hope you are preparing well. All the best. Thank you.